you can bring so you can actually bring this pole a little bit closer to you if you're having trouble, if your patient is like really tall or too far back. Can you see where I'm grabbing that at? That might be a really good place to actually put your barrier tape, right? Because you're gonna be moving that quite a bit. So you might wanna have it here or here. And because you don't wanna just grab it from here. If you do that, you're gonna jerk this right off of there, right? So you wanna make sure it's stable. And once you have it in a place that feels comfortable and is easily accessible for you, grab both handles, 45-degree angle. For this particular instrumentation, for probing, you'll kind of be mostly in 8 to 9, I believe your PowerPoint said, and that's just about right. You'll kind of be between here and here, right? So depending on what surfaces you're instrumenting, but probing with your mirror actually is pretty easy from, just around in this area. You do want to use your feet to pivot on the floor to move your chair. You don't want to move like this or like this. Right? You don't want to do this or this. You're trying to maintain a neutral position. So you're gonna, neutral hips keep you there. If you can use your feet and your legs to make that happen. I use the back of my thighs, my hamstrings and my quadriceps to do that. And I use my hips to kind of pull myself back in, right? Sitting back. So your maxillary will be something like this. I'm gonna go over probing in a few minutes, but it'll be something like this. Does everybody see how that works? So I'm going to show you probing in a second. I just want you to see how I'm sitting. So your clock positions are very important to keep a neutral wrist position. Can you see my wrist? Is it pretty neutral, or is it doing this? Is it doing this?
Yeah.
Is it doing that? So so what's happening, and you can actually, if you're having trouble with an instrument and you can't get it further back and you're trying to, that's why I wanted to show you without the skin first, because the dexter skin is kind of rubbery and it's going to be hard for you to retract. So I want you to see it beforehand, because when you get in there, you're going to actually have to be retracting with the mirror, and that's going to be another thing that you'll have to learn. But let's show you this, and then we can kind of go over the rest of it. So when you do your pin grasp for your probe or any other instrument, we kind of went over this in class the other day with you guys. Do y'all remember that? So a modified pin grasp, if you're actually holding a pin, it kind of looks like this, right? Your finger and your thumb are together, and typically your ring finger is kind of on the outside. Is that how most of you write? So no, calligraphy girl. Yes. Yeah, you write probably really proper. So a modified pin grasp actually just says that you're gonna hold it similar to a pin, except you're gonna separate the index finger from the thumb slightly. So you have control, and you can roll that instrument back and forth. Can you see how that instrument rolls really easy? When you get to instrumentation and not probing, that'll be really crucial. So get used to that pin grasp. You should have a C-shaped area of your index finger and your thumb. So it kind of shapes like a C. And that instrument should be anywhere from knuckle to knuckle. So knuckle to knuckle. If you do this, you're probably instrumenting a very difficult piece of subgingival calculus, or you're in there, you're trying to maybe, I don't know, pick out a tonsil stone or something like that. If you're doing any kind of serious instrumentation, you need to be here and here. Or if you're retracting, you might be here. So you might need a little bit more pull. But if you're doing something in a very tight spot, you're gonna be here or here. So when you're probing, you're gonna be doing intraoral fulcrums. So you're gonna be opening the mouth. With the dexter, it's a little harder because you have to force the mouth open, right? And then you're going to be walking the probe along the long axis of the tooth. The long axis of the tooth divides the tooth in what?
Distal and mesial.
Distal and mesial. Okay. Where is the long axis of the tooth?
The midline.
Right, the middle. Midline. Show me where it's at. You guys show me. Like that, like that, like that. Good. Everybody got it. Good. So it's apical to incisal, right? And it separates mesial to distal. Which side is my mesial side of the number 3? This side over here.
Yeah.
Good. You guys got it. And which is my distal? Okay. Do you have mesial and distal also on the lingual surfaces? Okay. Good. And where is the distal at on the lingual surface? So here, like that. Okay. And then over here like that. That's the mesial surface.
Yeah.
Good. So it's the same thing. That's why you guys have worked so hard on anatomy. That's why I pushed you guys so hard. Do you know your tooth numbers? What tooth is that?
3.
Okay. What tooth is this?
8.
What tooth is this? That's a hard one. 21. Good. Oh man, y'all are gonna make me look like a rock star in front of my dean. Thank you. Thank you. I love y'all. All right. It's showing you the love. I'll bring chocolate next week, I promise. All right. Give y'all like some incentive. So that's a maxillary. I'm gonna get more to the probing in just a minute. I wanted you to see kind of how I was sitting. That way you can see the neutral positions. We'll come back to the probing in a second. Right now I want you to look at the clock positions. So for different areas of your teeth, and you can look. Do you guys have this? Do you guys have this paper that looks like that for right-handed clinicians? So basically, all that means is that you're looking at your patient from this line of sight. This is your 12 o'clock position, and then you're kind of looking at it like just a time clock. And then so if you're right-handed, this will be 12. You're going backwards. This will be 11. This will be 10, 9, and then 8. You see how I kept my legs? And you can, you want to kind of keep that maintained. You want to kind of that balance because you're going to be using that a lot. For you ladies who do this all the time, that probably is not going to work for you. I'll be real honest with you. That's going to be very difficult for you to move around like that, and you're going to end up with a lot of twisting and turning, a lot of back problems. So get used to that position. It's just part of dental hygiene. You're going to be very close to your patient. That's why we don't wear a lot of perfumes or scented lotions or things like that, or a lot of makeup. We try to keep our patients as comfortable as possible because you are sitting literally right here in their face, right? So we make sure we don't try not to eat anything garlicky or like a lot of onions and stuff like that the night before. That's why we don't smoke typically in our profession, because we want to make sure we present a very professional image to our public, right? So when you're doing your, let's start with maxillary. So when you're doing your maxillary anterior surfaces towards, you want to be in an 8 to 9 o'clock position with the chin up. So this is supposed to be chin up, but where a little typodont won't stay. Can y'all kind of picture that? So this is basically chin up. Can y'all get that? But I'm not able to leave him to hold him there because he's flopping all over the place and he's got something on the back of his neck. So pretend like that is chin up. If I touch it, it's gonna go. So where is 9 o'clock for me? Everybody point to 9 o'clock for me as the operator. Okay, good. Where am I at now?
8.
Okay. And now?
11.
Good. Okay, y'all are easy. So the maxillary anterior surface is away, just mean the distal surface, right? Or the surface is away from you. So what you're doing is you're kind of looking at this from a different perspective than you'll still use some mesial and distal, but you're looking at it like this is a surface towards me, this is a surface away from me. So if you look on the upper right, surface towards me, right? If you look on the upper left, you actually have to use a mirror. So that's a surface away from me. So that's kind of how I kind of use that. And then you'll use that the same way. So if you want to, did they tell you any other way to kind of characterize that, how that surface is towards you or away? That's the way I like to do it. So what you'll do is if you're looking at a surface is towards you, you'll have the patient kind of in a neutral position. Sometimes you'll have them a little bit further just so you can kind of pull their cheek back and you can actually see within some indirect, if you're back there in the posteriors, you can kind of see with some indirect mirror imaging so you can kind of tell where you're at. But if you, it depends on how heavy their cheek is or how hard you have to retract their cheek. If you have to, you can kind of put them back in a neutral position, and you can even have them look towards you a little bit, depending on your patient. Everybody's going to be a little different, but surfaces away are usually tend to be when you have them turn towards the operator. So my surfaces away from me include your upper left posteriors, right? All those are the surfaces away, and there would be mandibular posteriors. And then and maxillary anterior surfaces away. So when you get to the anteriors, the surfaces away kind of separate in the midline. So surfaces away from me would be, because they're anterior teeth, they're going to be from the midline to the from the midline of the tooth to the mesial part of the tooth. Can you see that? So midline of the tooth to the mesial side. Those are surfaces away. Can you see why that's important? Away from me, because I'm going to have to change my clock position to be able to instrument that correctly with a neutral wrist position. My surface is towards me, you're actually going to kind of create that imaginary line down the long axis of the tooth, and you're going to kind of walk the probe from midline all the way towards the distal line angle. So those are your surfaces towards you. Does that kind of make sense to you guys? So on anteriors, they kind of split up because they're in the center of the mouth. Does that make a little bit more sense?
Yeah.
I like the way that sounds too. So what you'll do, and you'll do the lingual the same way. So the surfaces towards you are going to be the teeth, the lingual, the maxillary upper right lingual are going to be surfaces towards. The surfaces away are going to be on the other side, which are the maxillary upper left, posterior, right? The maxillary lingual upper left. And so you'll turn your patient away from you, towards and away. So does that make sense to you guys? Did I miss anything? Okay. So sometimes it's hard to break this down back to old school stuff, right? I have not taught first year, so if I miss something or if you don't understand something, please tell me and please let me back and I'll back up. If you need to, I would just go through this list right here. So mandibular anterior surfaces away. If you guys were gonna instrument, if you guys were talking about a mandibular anterior surfaces away, where are your mandibular anteriors? Which teeth are they? Number them for me. Canine to canine is a good one. But what's the universal numbering system? Close. 22 to 27. So canine to canine is 22 to 27. So if I was going to instrument the mandibular anterior surfaces away, what would that look like on the midline? I showed you what that looked like on the maxillary. Would that be here? Would these surfaces from the midline away? Would that be away from me? Or would it be from here back towards the distal? Are these surfaces from midline to distal? Are those surfaces away from me or are those surfaces towards me?
Those are towards you.
Those are towards me. Okay. So where is away from me at?
Midline
to the mesial. But now it crosses the midline. Now where are you at? Midline to what?
Distal.
So I can't always say mesial and distal. Do you get that? So you have to talk about surfaces away and surfaces towards. And so that's why that's important about the long axis of the tooth. Does that make sense? So now look at the lingual. So when I'm instrumenting from canine to canine and mandibular, and I'm not probing the correct way, so don't completely film this. I'm just trying to show you how it looks. If I'm instrumenting and I'm starting at the midline on this canine, and I'm trying to instrument my surfaces away from me, where would away be?
To distal.
To the distal. Now if I'm instrumenting number 26 and I insert the midline, I'm instrumenting away from me, where would it go? Distal. So do I look like I'm in a neutral position there with my wrist? No. So what position do I need to be in? Look it up on the paper. Mandibular anteriors, surfaces away.
11 to 1.
11 to 1. Let's see. So 1 o'clock means it's probably a left-handed, right? So we use 11 to 8 in the right-handed position. So just know that 1 o'clock is kind of optional. Some people can sit here and do that. I think it's extremely awkward myself. So I usually try to keep you guys about here. You can go up to here. I say 10. So now, can you see how much more neutral my position looks? I'm gonna start at the midline, and now where are my surfaces away at? If I'm looking in my mirror, where is my surfaces away? Just give me a direction on number 24.
Onto the distal.
To the distal. There you go. So I'm going to kind of, and again, I'm not doing the probe exactly like we're supposed to teach it, so I'm just kind of showing you guys where it's going. But now on number 25, if I start at the midline and I'm going surfaces away, where does it go?
To
It
distal.
still goes to the mesial.
Oh, mesial.
The mesial, but it's going towards the same direction, right? So distal towards the back of the mouth because it's away, and then towards the mesial because that's where the midline's at. So orientations is a little different. I hope I'm explaining that where you guys can grasp that. I might try to think of another way when y'all are doing that of how to